Okay, now let's make the putty for the bridge number 3 and 5. Again, you're gonna get half of a spoon of each. Then mix. But there is a trick here, which is like you have the occlusal grooves of number 3 and 5. That normally, if you go with the putty over there directly, you're gonna trap some air and you're gonna have voids right at the occlusal grooves. Okay, so I'm gonna show you a trick to avoid that. It's a trick that imagine that you're using like regular impression, you're using light body and heavy body, right? But the difference that you're gonna do it with the same material, which is like this. Once you're ready with the manipulation, you get a tiny piece of it, and then you just go and cover the occlusal surfaces of the molars and the premolar and squeeze it in so you get air out, you don't trap air, and then you do the same thing. Another thing, if you guys buy the fast set, this is explanation. I'm taking a lot of time, but you have to really do it fast, okay? So embrace here the dist of number 2, and again with 2 fingers like we did for the number 3 fingers, as we did for number 9, you go bringing it down with those 2 fingers and pressing it this way, but not too much. You don't want it thinner on buccal and lingual, and you accommodate with the thumb the top of it, and you make sure that you bring it enough to cover part of the gum down here. Okay, another thing that is important is try to make a flat surface here on the top, because whenever you're placing it on the table to cut, it's gonna be more stable. Okay, so again we need to do two types of cut for number 5 and 3. So I'm gonna get another portion, and while that one sets, I'm gonna leave this one ready, and I will show you the 2 cuts, and then I'm gonna show you again on top of a typodon that it has the teeth already prepared, that you're gonna see all the clearance and the parameters. Okay, this typodont is messed up because we did some temporary crowns here, so the acrylic gets stuck with the plastic. So almost there. We are going to cut this one on top of number 5 and on top of number 3 from buccal to lingual. And then as we did to number 9, for number 9, we are going to cut on top of the occlusals, right in the middle of the occlusal and up to the incisor of K9. With the small blade, we are going to cut in the middle to separate 2 layers, buccal and lingual. Okay, getting there. Make sure you remove it when it's very, very hard, okay? Because otherwise it's going to distort. And if it distorts, guess what? It's going to make you to do misreading. And if you do misreading, the bud is not doing what it was supposed to do, which is to help you, okay? So it's ready. It's pretty hard. So can you see here the sulcus, the grooves? no bubble. You see, it was completely covered by the material. Okay, so again, some excess here you can eliminate. I don't need laterals and central, so you can cut it this way, right? Again, thickness is important. This one could be a little bit thicker here, but that's fine. It's not bad. It's thicker here, right? Here is too much. You can reduce a little bit. But again, what is important, you still have that amount of material that's going to touch your gum. If you make it not at the gum, but at the level of the cervical, then it's going to rotate or you're not going to have stability. And then again, you're going to have misreading. Okay. So this one, exactly like number 9. Let's do this. Before I cut here, while we wait until the other one sets, I can do the explanation so we save time. So let's mix. So imagine if you're not using the fast set and you have to repeat this 3 times and you have to do 2 of these for each preparation. So you wait around 4 or 5 minutes to get set, and then it's not well done, you have to repeat. Then you lost 5 minutes, and then you did again and it's not good enough, you lost 5 minutes again. So then you lose a lot of time. So again, this is the quote unquote light body, right? And then again, I'm gonna do at this shape like this. Place here on this top number 2, go down, press with my thumb and with my 2 fingers. Make sure you bring it down to the cervical. Here unbuckle, get gum down here, over by it. Same thing on lingual. And again, try to make it flat at the top, so it's gonna help you when you do the cut. Okay, so while we wait this one, let's go back to this one. So here we have to do 2 cuts. We are going to work on number 3 and number 5. So again, we have to cut right on top of it in the middle, following the long axis of the tooth. You don't go this way, you don't go this way, and you don't tilt the blade this way or that way, and then you cut flat in just one stroke right in the middle. Better to do with a big blade like that instead of doing, imagine if you have to cut such a big amount of material with such a tiny blade. So no. So let's go this way, look from above, aim the middle of the molar, then don't tilt the blade, and in just one stroke, cut it. Boom, that's it. Right? And then with the one that it was prepared, we can test. So you can see. So when you're reading it, you cannot just leave it not touching the gum like this. You have to engage. Again, here is important to do this. You don't need embrasures, okay? So if you have embrasures here, sometimes that prevents you to fit well. So remove them. Just take them out. Here, the same thing. You see this embrasure? You don't need it. Take it out. Don't leave the pieces that you just cut inside, because that's going to prevent you to fit anyway, okay? So cut it and remove it, clean it. Still more. Okay. Even here, if you see that you need, trim it, okay? So you're gonna see that fits better when we trim the embracers like this. Let's try here for number 3. Okay. Then again, remember what I said about number 9, that you have to be parallel to the putty. So here, and this is very important, the second inclination. And then you're parallel, you see, you're parallel to the putty here, your prep as well. Your putty, so it's like a miniature of the anatomy that you had before, but lower, right? And here you have this plane, which is the retention area or first inclination, and then a slight inclination here for the second inclination. And then you measure it, you have to have at least half down here, and we are 0.7, 0.8, which is completely fine. And then you have to have half here, and then here on occlusal, you have to have around 1.5 for the functional cusp, and minimal 1 for the non-functional cusp, which is the buccal one. Okay, so then later we are going to go over some parameters that you have to do here to evaluate after you do your prep. So let's cut the other half. Let's cut the premolar. Premolar is tricky because it's smaller. Go here on the top, long axis of the tooth, right in the middle, all the way down, one stroke. That's it. So the other one is set. So let's test it. I didn't do this for the video of the number 9, but what you have to see here is it's fitting well. You have no void whatsoever, because we did that technique of the quote-unquote light body technique. You have no void here. If you don't do that, most of the time you're gonna see something like this, a void like that. And what you really need to see is this is zero reduction all over, right? So this is perfect. With this segment here, you can see both number 5 and number 3. And again, nothing here, no void. And I can see zero reduction all over. So I'm fine. I can proceed to my preparation. The other portions, you have the other half of the premolar that fits here. You can see from this view as well. Then again, we have the other end. That, no, this is the middle one. The other end is this one. So that's the zero reduction, no void whatsoever. So perfect, right? So now let's cut the other one. Again, remove some excess. You don't need to you don't need more than the canine. So cut the mesial of the canine, cut out the lateral and central. Don't need that. Okay. And then again, this is a curve that I have to cut. So with this blade that is too big, it's gonna be kind of hard for me to do, especially the curvature, because the blade is flat, right? So I need to do that with the tiny one. I can start here if I want from like here, because I can aim the middle. You see the groove? I have to cut right there at the groove. So I can aim the groove and then go down. Okay. But then with the other blade, I can start to separate, and I can even like apply some pressure this way to help me to separate and to go through exactly at the middle, at the main groove. Okay. And same thing here for the premolar. So go here, cut there, then here is thicker, go on top of the groove of number 5, and then the K9. Not like a very nice cut here, but it doesn't matter. What they need to see is this. So whenever they place it on virgin teeth, you're gonna see like that, 0 reduction, right? Little void here, but that's not important. Okay. And then from buccal view, they're going to see this way, right? And if we go on prepared teeth, you can see from buccal view and lingual how much you reduce it. Okay. That's what they want to see. Then, yeah. Okay. So now, what is the thing that you have to pay attention on your prep here? First thing is taper, right? So when you look from buccal view, this wall needs to be slightly convergent with this one pseudo-occlusal. If they are parallel, no. If they are divergent like this, no. And this wall, since it's a bridge, needs to be parallel to this one. And they are. And then this wall need to have some taper regarding this one. If you put two instruments here, let me see if I can do that here. That's a way of seeing if you have the right taper. If you place an instrument in one of the walls, and then you place on the other one, those instruments, those lines, they are going to meet each other somewhere up here. Same thing for the other one, right? So that's the way you read. You have to really touch the whole surface like this and that, and they need to be like this. They cannot be too much like this, so you give too much taper. They cannot be parallel like this, or especially if they are divergent like that. That fails you, okay, if they are divergent. So, and this wall needs to be parallel to this one. So this one is parallel to this one. This one is parallel to this one. And now you take a look from a lateral view. The cervical wall, which is the retention wall, right here. You read that and you read this one. Those two need to be parallel. If they are like this with different direction, different path of insertion, that's wrong. Then if they are this way, they are correct. And those two lingual, they need to do the same. The lingual number 3, but not up here, okay? The cervical, that's the retention wall. Cervical with cervical need to be parallel, okay? And another thing, cervical lingual of this one with cervical buccal also need to have that taper. Also need to have those lines meeting somewhere here on the top, like way on the top. If it's too much like this, no, it's wrong. You have to have first inclination and second inclination, and second inclination of functional cusps of upper teeth are very tilted like that, as you can see here on the second molar. So you have to reproduce the same, not only there, but also here. This one is missing here. We should have a second inclination here. So, and so you have to have this taper, and you have to also have this taper buccal with lingual. Then with the putty, remember the numbers. This is PFM for the number 5, so it's a wider prep. Ideally, you should have around 1.5 here at the cervical. Then when you go to the occlusal, you go to around 1.5 to 2 millimeters. I prefer to be at 2 millimeters because in real life for PFM, you really have to have 2 millimeters to fit metal, opaque, and then porcelain. And then down here, it can be just 0.5 because they believe that you can do this cervical third finishing in metal because it's non-static. That's fine. And then here, number 3, the numbers are minimal here at the cervical, 0.5. Here at the functional cusp, 1.5, non-functional 1, and then down here. Sorry, sometimes the lenses get confused and then don't get the right focus. And then here, 0.5. So pretty much that's what you have to do for the bridge, which is the most complex one, I think, and it takes very demanding, takes a lot of time. But with practice and with the help of the buddy and self-assessment, you can see if you're doing it right. If it's not, you can correct it. Then you can do a nice job, okay, and pass, right? That's it.